Hi, this is George Alger, and welcome to another segment of Our Ventura TV. Today's guest expert is Dr. Mata, who is joining us from the Philippines. He's also joined here today with his mother, who lives here in California. Welcome, Dr. Mata, and welcome, Irma.
Thank you.
So first of all, let's get a little information about Help for the World Foundation, which you're representing. Could you tell us briefly what that is?
These are a group of doctors that do medical missions, and mostly they go to the Philippines, and they do it every February.
Okay, so the doctors go from around the world to the Philippines, but you actually live in the Philippines.
Yes.
Okay, good. And then Irma, how did you get connected to Help for the World Foundation?
When my son got very ill in 1983, I started writing all over the world, and one of them is to former First Lady Nancy Reagan, who referred my letter to Dr. Nin Hayes of National Health Institute in Maryland. And also I wrote to the health secretary in our country, former health secretary Flavier, and sent a personnel to the Philippine consulate in LA and found Dr. Barone. And he talked to Dr. Barone to help us. And Dr. Barone sponsored us to come here and operated my son and help us, including Mrs. Barone. The whole family help us.
Wow, that's quite a story. Okay, so you were living in the Philippines at the time, and when you asked for help, you came to the United States.
Yes.
You got that help, and you stayed here. Is that how that worked
Yes.
out? Okay. And then you got trained as a doctor and
I studied in the Philippines.
Oh, you studied in the Philippines. Okay,
Yes.
so you moved back. All
Yeah,
right,
I went
and
back home, studied there while all my treatments are ongoing. So through all during my treatment, in between, I study.
good. Now, would it be safe to say that Help for the World Foundation inspired you to become a doctor?
Yes, yes. When during my treatment, I met the founders, and they are the ones who helped me. I said to myself, I'd like to be one of them someday.
Wow,
So these are one of the inspiration that I had.
it's a great story. Now, the medical condition that you had, you know, what was it?
It is called hemoglobin E beta thalassemia major. In layman's term, it is my bone marrow is producing a baby RBC, a baby blood, which cannot support the normal human adult body. So I have to be transfused with blood before it was every month or less than a month. And with that, my body was absorbing too much iron from the blood transfusion, and this too much iron overload in my body is destroying all the major organs in the body. So my liver, my spleen, my pituitary was affected, and my liver and my spleen becomes so big that I have to be operated during 1993, because it's really huge, and if it's not being removed, I'm going to die from it. So Dr. Barone, who is one of the founder of this Hope Foundation, is the one who sponsored me did the operation on me. It was 1994.
Okay. Now, did that condition get cured, or does this require ongoing maintenance?
Until now, it's in remission, is stable. They were able to control it, and I'm not getting any transfusion every month. I have my transfusion like every 5 to 6 months. So I'm not getting any frequent transfusion right now. So it becomes stable and controlled.
Okay. So Irma, could you speak a little bit about your experience with Help the World Foundation?
If it is not with the Hope for the World Foundation, my son could have been dead way back in 1992 or 1993 when the doctors in our country said the only hope for your son is the United States. And it was Dr. Barone and Mrs. Barone, the founder, who sponsored us to come here. So it is very important that they had this foundation and make my son a doctor.
Very encouraging. Now speak about the work that you're doing in the Philippines.
Now I'm working on the hospitals, and every February the group goes there and I join them. We go to different places to treat more than 100 patients every day, and every place they go there they stay for a week. So most of the time they stay there for like 15 to 20 days.
Okay, now, so your normal work is inside a hospital.
Yes.
And what city is that?
It's in the island of Luzon in the Philippines. We call the province Albay.
Albay, okay. And what's the name of the hospital?
The regional hospital.
Okay, good. Now, do I understand that the patients that you're treating, are they out in rural communities?
They are out in the communities. They when they the hospital announced that the group of doctors are coming for the medical mission, they inform all the communities to come.
Okay, so do you go out to all the different, or some of the different islands, or do you stay on Luzon?
Different islands.
Okay.
So different cities. Every city they spend 5 days.
Okay. Now, could you talk a little bit about some of the successes from the people in the Philippines that you've treated?
Most of them are surgical. The group do a surgical mission, and most of them they have this. Most of them they have mass in the body, and most of them have some of them have thyroid problem, and the doctors remove it. And we also have pediatric patients who are sick with different kinds of illness. You know, in the Philippines is a third world country, so we have tuberculosis, different kinds of parasites or to be treated like that. So during that 5 days, there's a lot of patients who are being operated and being treated and given medicines.
Okay. And I wonder if you might be able to highlight a story in the same way that your mom just highlighted your story, all right? Is there a particular individual that you might have helped that has already been able to improve their life or recover to some great degree?
There's this patient that we encountered. He had a water in his lungs that was not getting proper treatment, and when we get there, the infection already scattered all over his body, and this patient was very ill already. So when we get there, when we see the patient, we admitted the patient, we removed the water, and give him a lot of antibiotics. And thankfully, before we left, we checked on the patient, and the patient was already walking.
Wow.
Yeah.
Okay. Now, how does Help for the World Foundation determine which people to help in the Philippines?
Mostly we get the patients, the ones that are really doesn't have the capacity to pay.
Okay.
We don't exclude anybody, but mostly the ones that get this avail this medical mission are the ones without the capacity to go to the hospital and spend money and buy medicines or get this expensive surgery. So for most of the time, they just try to ignore their cases, like with the one with a neck mask is become big, or the one with the water in his lungs. So because they don't have money to go to a hospital and buy a lot of medicine and had this surgery. So these are the patients that mostly try to grab the opportunity to go to this medical missions. So these are the patients that mostly helped by this group.
Okay. And all of the expenses are covered by Help for the World
Yes,
Foundation?
it's free. They don't pay anything.
Okay. And then can you speak a little bit about where some of the other doctors come from? I mean, do they all come from the United States, or do they come from around the world?
Most of them are from here in California.
Okay.
And they also have a friend who are in the Philippines, so they also joined the group. So there's a lot of doctors that joined this mission. The last time we have about 60 doctors doing this medical missions.
Good. And do you remember how many patients you were able to treat in that February?
Yes. In one island, in one city, there's almost like 1,400 patients being treated in total. And in this other island, there's like almost 2,000 patients.
Really?
Yeah.
That's amazing.
For 5 days.
Wow. Now, what happens after those 5 days? Some of these patients are going to need, I imagine, some continued help. Is there other resources that can take them to, continue with them after the 5 days?
Yes. Before we leave, we give them the medicine they need for how much they need it.
Okay.
So they are covered.
Good. So we're just about out of time. Irma, I was wondering if you might offer a brief statement about Help for the World Foundation.
Since I have seen and I have benefited from the foundation directly or indirectly, I would like to ask donors to help the foundation because it saves people. It helps ill and sick people all over the world, not only in the Philippines. And I guess one thing is, without them, I could not have a doctor son.
Good story. And then before we close, I was wondering if you might be able to give us the name of the website for people who would like to find out more, and if you have a summating message you'd like to convey to the viewers.
Okay, it's www.hopefound.co. And I would like to ask the people to donate and join this group, because this group help a lot of people, not just a Filipino person, but all over the places. And to prove to them, I am one of the living proof. I am one of the people that have been helped and saved by this group.
Well said. Thank you, Dr. Mata, for visiting. Thank you, Irma, for coming
You're
by.
welcome.
This is George Alger signing off for this segment of Our Ventura TV. Until we meet again.